Hello, everybody. I'm Wilson Hurley, and I'm here with Marlys Rixey, Psych.D, a licensed clinical professional counselor who specialized in health psychology for 25 years, over 25 years. In her private practice, she works with individuals, families. She specializes in anxiety-based disorders, stress-related symptoms, depression, relationship and lifestyle issues. She has been a lecturer with the Diabetes Education Program through Johns Hopkins and Suburban Hospital. In addition, she works as a behavioral health consultant to Suburban Hospital's Cardiac Rehabilitation Unit, where she counsels cardiac patients and their families. She has developed a mindfulness-based stress reduction program to address the needs of the cardiac patient with a psychoeducational approach that addresses risk factors for cardiovascular disease. I'm so glad that you're taking the time to be here, Marlys. I really appreciate it.
Thank you.
Um,
It's my pleasure.
oh, thank you. Um, so I have first question for you. How did you become interested in health psychology?
Well, my own journey, as with many of us, led me to discovering how to manage my own life stressors. And I found that through movement, through music, through meditation, and nature. As an undergraduate, I was taking a modern dance and improvisation class, and I noticed a real shift in my mood and my well-being. And so I started taking human development and psychology classes and was able to form my own degree program in preparation for a master's in the creative arts of psychotherapy, which at the time was a very new and an exciting field. It was as close to mind-body medicine as we had back at that time. Now we have the field of psychoneuroimmunology. I was fortunate to intern at one of the first cardiac rehabilitation programs in the country outside of Boston. And I found my passion, um, helping patients move forward in their lives after a cardiac event through utilizing this sort of eclectic form of therapy, which today is almost universally embraced in both the medical and the mental health fields.
In many ways, you were a pioneer. Um, and I know exactly what you mean. It's a different world that we're working in today. Um, So, what have you discovered about the connection between the mind and the body? How do you see them interact with each other?
Well, in our culture, in our Western culture, the focus tends to be more on parts of the body. We separate the mind from the body. We have specialties. We have cardiologists, we have rheumatologists, we have psychiatrists. And mind-body medicine really sees the body and the organism as a whole. And we know through research that how we think and feel, our states of mind can affect our body's ability to both heal and to thrive.
So, my next question is in two parts. The first part of the question is how do unpleasant emotions like anxiety, stress, depression, and anger affect our bodies? And I might as well say the other half so you can go back and forth. Conversely, how do positive feelings like love, gratitude, and compassion affects our bodies and our minds?
Yes, anxiety, stress, anger, all of those heightened negative emotions, especially anger, um, triggers disruptions in our heart rhythms. Uh, and these emotions cause a shift in our entire physiology, specifically our sympathetic nervous system is elevated, causing an increase in our blood pressure, our heart rate, our oxygen consumption, our blood flow, a constriction in our arteries. as well as flooding the body with stress hormones, including cortisol. And over time, this response, this increase in the nervous sympathetic nervous system, increases our risk of cardiovascular disease and compromises our immune system. Positive emotions, on the other hand, such as love and awe and gratitude, have been shown not only to expand our blood vessels, but to help regulate our nervous system and what's called our heart rate variability, which is sort of a barometer of our nervous system. And it can actually, the positive emotions, what we find is that the positive emotions can actually balance that system. And that's very exciting to me, to find out that how we feel can, through some very specific exercises. One exercise that I use with my patients is, it's different than a visualization. It's a memory recall. And when they find themselves triggered by any kind of negative event, and they can feel themselves being triggered, the first thing they do is work with their breath to self-calm. And we work with coherent breathing, the even breathing, and the elongated exhale, in order to lower their blood pressure and their heart rate and really calm themselves down. This may take 2 minutes and it may take 20 minutes, but they stay with the breath until they feel that their physiology, at least their heart rate, which they can feel because a lot of them wear the watches, they can say, oh, my numbers are great, look, after X amount of minutes. So they self-calm. At that time, once they're calm, they bring to mind a memory. And this memory, I call it a snapshot, or a frame that we put about something very specific that has happened in their life, that they felt a sense of joy, of awe, of love, which is different than, oh, I had this wonderful vacation. I was like, okay, but the moment that vacation, when you turned around and saw, a sunset, a sunrise, a piece of art, holding a child, any moment in your life that you could actually feel your heart expand, that feeling of love. And we all have those moments in our life. So, but to be very specific and recall that event at that moment, and then stay with it, what we call savoring that moment, that one memory, that snapshot, invoking all of the senses. Remember what it smelled like. What were the colors like? What was the environment like? Really taking yourself there and savoring it for as long as they want. And what we found is the heart rate will rebalance. And that's very exciting research. And I think it's nice for people also to make a list of those moments in their life, because we know about the gratitude exercise each day, having that sense of gratitude and trying to think of different things. This is a little more heightened emotion, where you really felt, that sense of awe.
Wonderful. Not only is joy fun to feel, but it's good for your heart. Right?
Absolutely.
I've met a lot of people, when it comes to the difficult emotions like loss and anger and fear. A lot of people try to stuff it. What does that do to us when, instead of accepting the emotion, is it better to accept the emotion, or is it okay to stuff it? What's your thought?
Well, I think the importance of identifying and actually naming the difficult feelings or emotions allows us to consciously be aware of them without being hijacked by them. when it comes up. Kind of the core of mindfulness is that non-judgmental awareness of them while they come up, which if not results in a reaction as opposed to a conscious action of it. And if unacknowledged, if these negative feelings are unacknowledged and we suppress them, they tend to lodge in our body. And we have, we have sense memory, we have muscle memory. If may ask someone, where are they feeling the anger, or where are they feeling the sadness in their body? And they may feel it in their chest, or they may feel it in their jaw, or they may feel it in their stomach. And then we can work with a somatic release. And that can be as simple as breathing into that area and filling that area with breath, and breathing out the emotions. Or it might go into a movement, and where I do a tension release movement, such as shaking, and shaking it out, a la Taylor Swift.
That is so descriptive and so wonderful. And I know that you must be familiar with the research, like for instance, depression raising the chance for stroke in patients and things like that. And it sounds like mind-body techniques are so helpful to avoid that and to get people out of that danger.
Exactly.
What are some of your favorite techniques for getting people who are out of touch with their body and out of touch with their emotions to help them tap in and learn how to regain their equilibrium every day? How do you help people do that?
Right. Yes. Well, when you spoke about depression, the thing about depression as a mental health issue, depression also depresses the body. And so sometimes any kind of movement, when people are feeling low, will help you get out of that. Just taking a walk around the block, just getting out of the chair, just moving the body on any level will help. Because the heightened emotions with anger and stress, you want to lower the body, right? But when the low moods, like depression, you want to lift them up and get them to move. The technique that I begin with people that tend not to have a good sense of their body is, again, one of the core components of mindfulness, which is the body scan. And simply and I will start a meditation with the body scan, just having them start at the top of the head and just noticing, what are you feeling in your forehead, in your jaw? What are you feeling in your chest? Just noticing the sensations of muscle tension, because it's easier for people to connect to muscle tension, and then go deeper into other sensations, and then saying, well, what is that feeling? What is that thought coming up? So I think the body scan is a very workable exercise and technique for people just to begin to notice and check in with their bodies and their minds.
Excellent. And I found that I needed to do that early in my career when I started having esophageal spasms because of the stress. And I found it absolutely essential for my survival and as a social worker. So the last two questions, I know that you have some exercises to show us. So after I ask these questions, I'll pause the recording so that you can get up to show us the exercises that you had in mind. But the last two questions are, what do you personally use every day for your own equilibrium and mind-body health? And would you share some with us so that people can try them?
Okay, well, thank you. I will share with you what I do for myself on a regular basis. But I also try to get outside every day. I'm fortunate to live around a lot of wooded areas, and I enjoy nature. So I do try to get outside and do mindful walking on a daily basis. But there are days when you can't get outside as much as we want, and that's when I do my movements, which are based on qigong exercises. I refer to it as breath with movement. Very simple, repetitive movements that you can do for 10 seconds or 10 minutes. But I find the repetition of the breath with movement, it's like a moving meditation. And it doesn't have to be complicated. It's the intention and the focus and the connection of mind, body through the breath and the movement that helps to ground and center me.
Well, I'm going to pause the recording for a minute so that you can get in place, and I'll tell you, I know I'm going to add whatever you do to my morning routine. So I'm looking forward.
So whenever I begin any kind of movement, I ask people to be aware of their bodies in space and make sure that the concept of feeling grounded is very important. Having them feel their feet on the ground. And so standing with your feet approximately hip length apart, and what we call soft knees, okay? Thinking of your knees as shock absorbers, those soft knees. And the body on top of that is aligned in proper alignment, not forward or back. So when you're standing and your feet, weight is equal on both feet. That's I call that being centered, coming back to the center and feeling grounded, and just taking a couple breaths with that. Then a warm up I use is our rotations, and warm ups can be anywhere that you have joints. So we spend a lot of time on our computers. So wrist circles, I use 4, 6, or 8 rotations in each direction for your joints, wrists, shoulders, and again, not involving the neck or the spine, but trying to just isolate the shoulders. And you can go as slowly as you want or as fast as you want, but again, in both directions, really feeling that slow rotation. Again, the slower you go with these movements, when I'm talking and teaching, I tend to go a little faster, but wanting to slow down and really sensing those rotations. A lot of people have trouble with knees, and so making a circle with your knees, keeping your feet flat, and doing what we call knee rotation. So you're feeling the knees and the ankles rotate. And I tell people to focus on the bottom of their feet, feeling the weight of the feet go from the right side to the heel, to the left side, to the toes, all the way around, and then reversing those rotations. So you go from the ankles to the knees to the hips. So those rotations are very important, kind of lubricating the joints, as we say. And then sort of a nice tension release is just to lift the heels up and just drop. Lift, drop, lift, and feel it. And sometimes people don't feel it above their waist. And so they know there's a lot of holding. So being able to feel that going all the way up to the chin, right? You know that you're releasing that. Which leads me to shaking, which I referred to in the past. There was a wonderful researcher who was traveling the world and researching healing in indigenous tribes all over the world. And what he found, he said, the one commonality in every single shamanistic tribe that he went to was shaking. He said, they all shake. He said, if you do one thing in your life, shake. And so, and I think this is self-conscious for people. So, but in the privacy of your home, just trying to be a rag doll and starting with maybe 10 seconds and then increasing it to a minute. And the goal is 2 minutes of shaking. And really, so, and it's doing wonderful things physiologically also, but it's a wonderful tension release, is just shaking. Then I go into a weight shift. And I love this one. I have a little bit of a wider stance with this. And whenever you're moving and bending your knees, just you want to make sure that your knees go over your toes, right? Whether your stance is close or wide. But just weight shifting from one side to the other thing, I think of it as sort of an hourglass full of sand, and you're shifting the weight, the sand into one leg, and then you shift the weight and the other leg fills with sand. So I'm kind of going up and over as I'm just shifting the weight. The wider the stance and the lower the stance is going to depend on what your intention is. And then you add the arms to what I call polishing the table. And so if you try to stay low, the lower you go as you're polishing the table, you can feel it in your legs. It's a strengthening. Okay, and then the breathing with this is even. So your inhale and your exhale can be whatever rhythm you want, as long as it's even. So I might be breathing in, 2, 3, out, 2, 3. Whatever you want but we want that even breathing throughout. So again, you can do this for 10 seconds or 10 minutes. But that nice weight shift. Then I go into a spine work, what I call it. And one of my teachers said that you should flex your spine in all 6 directions every day. And the 6 directions of the spine are forward, arching back, side, side, twist, and twist. So the first movement of forward and back is what I call an open close movement. And so as you exhale, I'll show you on the side, as you exhale, you're going to go into a C curve, curving your spine as much as you can on the exhale. And then as you inhale, you're going to lift, and this is a chest opening. As you lift and look up, it's kind of an arch, like that. So you're going to exhale as you close and inhale as you open. Exhale as you close. Inhale as you open. You can breathe in through your nose and out through your mouth, or you can do both in and out of your nose. I tend to like to exhale through my mouth, but again, keeping the movement and the breath very even. So that's open, close. The second movement of side to side is feeling that stretch on the side over and then side over. And it's just allowing, again, it's a weight shift that we did before, but it's adding the arms and just allowing that nice curve and stretch from the hips all the way over. And you can feel that, again, the breathing is even. And sometimes I lose track and I'll just do this for a while. And sometimes I'll just do it 4 or 5 times. It depends on my needs. The last one is a twist. And there's 2 movements for this. One is with your feet, again, hip length apart, and making sure that as you do a twist, you want to start with the ankles, knees, hips, shoulders, head, like that. As you look over your shoulder and then over your shoulder. And you only go as far as is comfortable. And then you let your arms simply hang. And they just swing. Just the centrifugal force of the movement allows that nice spinal twist with breath. And sometimes you can take this into a real so it's much more of a release on that. Another twist, which is a little slower, not so much of a release, is what I call backstroke for those swimmers. And that's where your eyes follow your hand as you do the backstroke. And the breathing again for this is even, so you might breathe in and out, and in and out. I like to do this one very slow and contemplative after the swinging before. Really feeling that whole spinal twist. The last one is, well, there's 2 components for it. If you only do 1 movement, okay, you have time in between sessions and you have 5 minutes and you get a drink of water, do this, woof, do a couple movements. The act of lifting your arms over your head automatically brings the breath down to the lower lungs. It forces you to take a deep breath, breathing in as you lift the arms and then exhaling as you come down. So just breathing in and breathing out. Breathing in, breathing out. Breathing in, breathing out. The next level of that would be where you inhale, and as you inhale, the palms are facing down until you reach shoulder level. We call this gathering the energy from the earth. Then you, on the inhale, as you exhale, it's a widening. Again, it's a chest opening, widening stance. Then you inhale, turning the palms up as you come overhead. This position is called heaven and earth. So then you exhale as you're stretching your arms towards heaven, as you simultaneously press your heels into the earth. So it's a pull from both heaven and earth. And then you inhale as the palms come down one over the other to reach the top of your head. So that's a short inhale. And then an exhale as you push the energy down the spine, the negative energy down the spine and into the earth. So it goes like this, breathing in, breathing out, breathing in, breathing out, Breathing in, breathing out. Nice, long, extra long exhale. Breathing in, breathing out, breathing in, breathing out, breathing in, breathing out. Do it one more time. Breathing in, breathing out, breathing in, breathing out, breathing in, breathing out.
Thank you, Marlys. That was wonderful. I'm feeling relaxed already. You know, I can feel the tension in the shoulders and everywhere else start to drain. So this is so helpful. I really hope a lot of folks watch it and try it out. You know, of course, accommodating to their own physical health, you know. Um, but I think it'll help a lot of people. I really appreciate it.
Well, it was so nice to be here with you, and thank you for inviting me.
Of course, my pleasure. Now I just have to figure out how to stop the recording.